Hi, Josh. Good morning. Thank you so much for coming to chat with me today. I thought it would be a great opportunity for us to discuss the opportunities that are present in the physical therapy world today. And I personally feel there's not ever been a better time to be a physical therapist with all the opportunities that are out there. And I was just wondering what your point of view is on that.
I honestly, there could not be a better time to be a PT if you're somebody that's thinking outside of the box. I think that you're largely seeing PTs get into a variety of settings, clinical and non-clinical, online and in person, and also just with the things that you can do with regards to the level of access that people have to you now with things like direct access, the request for imaging. The PTs used to maybe graduate and think that they were going to just be in a home health setting, an acute setting, or outpatient. And the things that we've seen, even some of our students go off to do, really has been quite nice to see. You know, if you're somebody that's going to think outside of the box and you're willing to put in the extra work to carve something out for yourself, the opportunities are endless.
Yeah, I would totally agree. I think the silver lining from COVID was telehealth, right? And the opportunity that has presented for people in terms of online triage, virtual care, this hybrid approach to outpatients, and if your patient is traveling, to be able to stay connected. Have you been seeing that as well?
We've definitely seen that, especially with people who, for us, we see a good amount of college athletes even, where they go back to school, they worked with us all throughout the summer, we can still stay in touch there. If you have people that are going on vacation, if you have people that are snowbirds, you're able to stay in touch with them, still deliver a service. I almost call it like it's like you got your PT in your back pocket, right? You pull your phone out, you're still able to maintain connectivity. And then, honestly, we've even seen more of a push for PTs into the wellness and fitness side of things. I've even had two PTs one who was a student with us and the other was with us for a short period of time, but spin off into social media influencing. And they're, have considerable followings, and they've been able to completely remove themselves from in-person care as a result of the opportunities that are present in the online world.
Yeah. You know, what I also think is fascinating, I read a new statistic that came out in talking with people from the APTA, and the amount of physical therapists or people with physical therapy training who have gone into the quote-unquote C-suite as chief operational officers or higher is really starting to grow. I think right now there's somewhere between 56 and 65 physical therapists who were trained as PTs who have progressed. So I think that opportunity to take our skills as diagnosticians and people who have to assess something and then come up with a plan is really indeed a skill set like for life. Have you been seeing any of that or talking to therapists who have really grown in a different world? I mean, I think traditionally it was more thought of as a practice owner. You would, if you had that kind of leadership skill, you would end up becoming a practice owner and maybe running a bunch of clinics. But from the hospital side, we're seeing more and more therapists who are infiltrating the hospital operations side
Yeah, I don't know if that's a job opportunity for me, if you're trying to recruit me over to HSS.
Yeah, we are.
But myself, I can remember back being a chief officer, so to speak, in the beginning stages of the company. I think I've been more aware of it just as our company has grown. We're not HSS, but we have a team of 80-some people. Who better to be a problem solver, to be versatile, to be able to understand reactive and proactive care and some of the different narratives that are largely affecting the medical world. I mean, we get to spend the most amount of time with people.
Right.
And we probably have some of the best awareness of things that patients are going through, that they are experiencing because of the relationships that we've been able to create. So that doesn't surprise me. It's something that I would love to see more and more. I think that the big gap that still presents itself is largely the education gap around business. And I think that's something that hopefully more of the PT schools are going to be aware of and put solutions in place to better prepare professionals for some of these less traditional roles, the business world, the corporate space. How do things work on a policy and procedure level at higher and higher levels of the healthcare system?
Yeah, I would agree. I think maybe when I went to school, back in the dark ages, I don't even think we had a business class. And then over the years, I think maybe there's one or two in finance. I mean, when I went back to school, I got my MBA on purpose so that I could learn like that side of the house. But you do bring up a great point in terms of the therapist's ability to interact with people. And I think that therapists in general are wired from a positive lens, and that they bring that positivity with them to the workplace. And that, I think, only helps when you're trying to build culture. And so much has been discussed these days about culture and the importance of culture and hiring for culture versus talent. And I know that at Rehab to Perform, you do a lot with hiring and retention related to culture. Can you chat a little bit about that?
Yeah, I think it's kind of a buzzword nowadays, right?
Right.
You hire people first. You can train skills, you can upskill them while they're with you. I think one of the things that comes to mind first is probably just leading with values. So, right. Are the values something that has been constructed by the team? Is it relevant in today's climate or in
right.
today's societal landscape? Do you have a list of principles that then put some of those values into action? How often are they referenced? For us, we have our core values. They're on the wall of the locations. People see them. They're normally in break rooms. They're present in the company handbook. They're present in policy and procedure manuals. When things go well, we reference them. When things don't go well, we reference them. So how much are they a living and breathing part of everything that you have going on at the company? And then I think there's other things that kind of add into these elemental layers. What is the level of dress or attire? What's on the walls? What are these affirmations? There's quotes even on the wall behind you that I think are subtle reminders of who we are, what we do, the why of the company. But people are getting a lot more attached, I think, to things of meaning. There has to be a why that brings them to work every day, a why that they can kind of get behind, that other individuals are sharing. And that has to be communicated by the leadership of the organization.
Yeah, I totally agree. One of the things I loved best was when we were talking at the Web PT conference Ascend, and we were in the back room kind of chatting about some of our cultural values, and realized that some of the things that you do at Rehab to Perform and we do at HSS were so aligned. And I think it's a philosophical shift for culture to be a strategy of the organization. And I know that we feel very strongly that when you hire an individual whose cultural and core values are aligned personally with the culture and core values of the organization, you really have the best fit. And then, as you were saying, we take those as the foundation and then teach, right? If you're blessed to have a group of people who can teach, you can probably teach almost anything to anybody, but you can't teach the core values, right? I feel, and I would be interested to your thoughts, I feel like people are wired a certain way, and you can't change anybody, right? The only person you can ever change is yourself. So you need to make sure that through the hiring process, you're hiring people on purpose and intentionally that are aligned with the core values of your organization. Because if not, you really don't have a good fit. And those are things you can't teach for necessarily, right? Being team-oriented versus I-oriented, really being passionate and really feeling like in your soul this is the right place for you. We chat a lot at work about time, right? Time is your most valuable asset for all of us, and we never know when that time is up. I wish we did, but we don't. So if we're spending, and as I've gotten older and older, I think it's so important for people to be spending their time doing things they love, whether it's at work or pleasure or hobbies, because your life is so short and we spend so much time at work. And if you don't love going to work, I would challenge people to say, well, why don't you shift, right? Not saying that every day's perfect, because gosh knows there's hiccups everywhere. But when the pros don't outweigh the cons of where you're going, I think people have to look introspectively and say, why am I doing this?
Yeah, and I think the thing that makes me think of is just the ability to have conversation and kind of feedback loops within an organization. And,
right.
And some of what you're saying there, I think, makes me think of individuals who might have started out with a company for one reason, but maybe their professional journey or professional aspirations change.
Right.
And potentially not having the ability to communicate to leadership. Hey, I have different interests now. I feel differently about what it is that I'm doing on a regular basis. One of the benefits of being at a place like HSS is there's so many different pathways and tracks where an individual might originally be attracted to the organization, and maybe they're doing things with regards to their professional goals, but then all of a sudden they have things change in their life, and for one reason or the other, they want to end up in a different situation. For you, I'd be curious, like, what are some of the different ways that you're able to really hear from your people so that they can maybe better communicate what it is that they're they're interested in doing, especially given the fact that sometimes when I hear the word burnout, I almost hear the word bored. So if an individual doesn't have alignment with what it is that they're doing, they're not pulled in this direction because it aligns with their why. Like, what are you all able to do to kind of hear that individual and then maybe kind of just shift them in a new direction?
Yeah. That's, thanks for asking me that. So I think some of the key things, I mean, you started talking about it. I think it's the ability of a leader to be approachable, and an ability of a leader to be visible, because you need to be walking around and seeing and listening.
So much different with a handshake and a smile, right? Rather than this.
We've talked about that a lot. You know, one of, just as an aside, like one of the no's at HSS when you come for an interview is if A, you're not dressed professionally. I know people loves to wear sweats, but I really don't want to see that when you're coming
Do I need
to
a
the
scarf
clinic.
like you?
Yeah, no, you probably could
okay,
use a tie, but hey, that's okay.
All right.
But the other thing is someone's ability to have presence, which means you can make eye contact with me. We shake hands. It's not this wishy-washy thing that gives me the heebie-jeebies. And you smile, and we can make a connection. I think that's so important also for leaders. And leaders need to be able to walk the talk, so to speak. So if you're going to profess values and communication and open dialogue, you need to be visible and openly communicating with your staff. We do a few things at HSS that I would argue are more structured, right? So everyone has an annual performance appraisal, where the goal of the performance appraisal is more for feedback and growth. And then we do a 6-month developmental tool, which is totally aligned for that. In addition, we have a clinical ladder, which I want to talk to you about. We talked a lot about therapists or all of your staff being able to see where they can progress in their career, or what avenues, traditional and non-traditional, they have in their career. The other thing I do is I do open feedback. So purposefully, twice a year, I go to every clinic. We have about 22 locations, and I meet with the team. And the agenda of the team is I'm here to listen, and there's no topic that's off limits. Fire away. I will answer them all to the best of my ability. And if I don't have the answer, I will get back to you. Because I think within an organization, and similarly, you have 80 employees, you have your core values, but every clinic has its own little vibe. And you don't want to kill that, So you want people, nobody wants leaders who are clones of each other. But I think we want some standardization and ability. So I think a leader's ability to be visible, and I think in this day and age with telehealth and remote work, my personal view is that it's more critical today than ever. Because what you don't feel online is that vibe you get from somebody when you walk by and go, oh, Josh isn't good today. Something's off. You don't get that online. People go online, they have their conversation, or you have your meeting, everyone buzzes off. And I think what's missing from that is that idle chit-chat, that personal vibe. You see most people from their head up. You can't see the rest of their body language. And if 60 to 80% of communication is through your body language, you've just totally cut it off. So I think that's also important. I know you do some things as well, so maybe you want to add to all the things I missed.
Zoom. You're just hoping that they're wearing pants on Zoom, Okay, so...
Don't stand up. Don't stand up.
I love that you use the word vibe, because I think that when I think of vibe, I think of just connectedness. And there's a vibe amongst people. There's a vibe amongst the environment. I think that as people, kind of, they grow, they evolve, and I don't want people to all be clones of one another. You want a word, and I think we use the word diversity a lot, and I think the one thing that gets lost in that is the diversity of thought, the diversity of how people operate. We need a certain amount of contrast. There needs to be some contrast to the room. There needs to be shades of gray. We don't want all of the same color, and I think that leads to largely like a higher performing team. I mean, there's a lot of research out there to support that individuals that bring different skill sets together most likely are going to perform a lot higher than individuals that are all doing the things the same. I even think of that in the sports world, where some of the most talented teams, you have too much like and like, and there's friction that's created, and they don't end up being in a situation where they're winning a championship. They're not winning a championship, and people are left wondering why. So I think
that's the special sauce, right?
Yes.
It's not the skill.
Right.
It's whether the vibe, the culture, like what else is pulling that group to have sensational performance.
Agreed. And I think the thing that I love that you said too, it was visibility, it was approachability. There are things that I love using the word like feedback loops. One of our operating principles is feedback is a gift. So if we are all able to embrace feedback, we're able to treat it as that present. I think that's amazing. The fact that you stand in there and you take a Q&A in person is awesome. That's something that I think what I do on a parallel is, I show up to an office, I'm there for 4 hours. It's permission to bother me time. So I might look like I'm doing something, but my door, my door, quote unquote, is open. I'm actually on the floor. I'm like, just, if I'm in the way, tell me to move. But I'm here, and you can block time with me. You can come over and tap me on the shoulder. We also just got done Q3 reviews. Like, I love doing an internal net promoter score now. So we have something where we ask our team, how likely are you to refer somebody to work here? Much like we're doing with the patients. So we want people to say, hey, this place is so amazing. We want you to work here. We want friends to work here. We want family to work here. Like, that is the best representation of an environment that people want to join, outside of like, hey, what's going well, what's not going well, what can we help you with, and what would you change? Those are our other questions. And the ability to move quickly and still be agile and still address things, like you said. Even if I get that virtual feedback, can I pop on a recording and communicate certain things to people in real time, knowing that timeliness is something that's also valuable to people. So with some of the different locations, with some of the different generations, what are some challenges maybe that you've seen through your career and maybe more recently? And what are some ways that you're doing things to kind of address all of the different dynamics of what can plague a healthcare environment, or what is helping you out with regards to making sure that HSS remains a high-performing team? Yeah,
so I think getting back to culture and core values, I don't feel like we've seen some of the generational differences that some other people have been talking about, because we hire for core values. So whether you're a Gen Z, a millennial, an old baby boomer like me, we are aligned in our core values still. I do think the needs of people have changed, especially since COVID, and work-life balance and having time with their family, or whatever people define that as. It's very different for everybody. I think getting back to what you were saying, even as leaders, just to backtrack a minute and being introspective of yourself, knowing what you do well and what you don't do well, and then hiring for those places that you don't do well on purpose is super important, so that your team, can build trust and have passionate debate, because you don't want to hire someone like you, because then you never get like a different point of view.
We don't want yes sirs and yes ma'ams.
Right, not at all.
Definitely.
So I think the concept of diversity of thoughts and diversity of experiences is important. I think that's one of the things that helps the team in HSS bond, by having opportunities like to volunteer for the marathon, or work with the road runners, or to be able to do humanitarian outreach. It doesn't matter how young or old you are, how much experience you have. If you want to volunteer, you can. And I think all of us getting out of our comfort zones and doing something we've never done is where the real growth happens. But that being said, I think there are some challenges today in physical therapy in general. The debt that a therapist graduates with now, on average, is somewhere between $60,000 and $100,000. I found that staggering. I guess I had my head in the sand a little. And that was very real at the Ascend conference and a few other conferences I have been at. And I think that's something we have to tackle. if people are going to choose a profession and then come out with potentially 6 figures of debt, I think employers need to look at that. You know, we currently at HSS don't do anything to offset debt. I know some people are, and that conversation is starting to come up. And I think that with COVID, if I'm not mistaken, but please correct me, like 22 or 23,000 therapists left the profession. We only graduate 12,000 a year. So there is definitely a gap. So hiring, as we've talked about, has become more challenging when hiring for the best fit. But I think with all these challenges, there's also opportunities. You know, we're blessed to be in New York City. We're blessed to have a wonderful reputation. But as we heard at some of the conferences, if you're in a rural environment, you know, getting therapists out to a rural environment is really challenging. And we heard from colleagues around the country about staffing.
Yeah, the debt thing really stands out to me,
Yeah.
I think, and this is not to speak negatively about any one college in particular, but I think the hardest part sometimes to hear is the lack of education that's presented to people initially about debt. I don't think there's enough education about the debt you're taking on. I think too many schools also discourage people from working, which is also, in my opinion, not very positive. There's plenty of people out there that go through education and they work, and they go through education and they work. And one of the things that I would argue that also makes somebody more employable, and I love to see it on a resume, oh, you were a personal trainer. Oh, you were in the service industry as a server or a bartender. Oh, you're coaching kids. Oh, you're working in this organization with people out in the community. So I think largely that the financial benefit, the soft skill benefit that you get from working with a lot of different people is highly, highly valuable. So I'd love to see more colleges educate people on the front end about your debt. Tell your students that it probably is going to be beneficial for them to pick up work while they're going through school. Knowing that, in my opinion, this might be unpopular, a straight-A student doesn't necessarily make you the best PT.
Absolutely.
I don't know what your GPA was when you were at school. I was a B student, okay? And I think things are doing okay for me. And I also did not graduate with nearly the amount of debt because I was doing other things at school. And the resumes that I don't quite like are what I see, and they're very, very short. And it just seems to be PT, PT, PT. And I'm like, man, I don't know. Like, are you going to be able to juggle life well? Are you going to be able to, you know, put yourself in a position where you're not struggling with work-life balance? Are you going to get potentially burnt out as a result of what's going on? But when I think about burnout, sometimes it's maybe you've been just very, very like narrow-minded. You haven't been focusing on all of these other things.
You're not having any fun.
No, like what are you doing? What are you doing? Like, is this a human or are you a robot? You know, like all we're doing is PT school. Like,
oh my God, God
man,
forbid.
you know. And then other things, like I can look back at school and I'm like, yeah, yo, you're staying in the nicest apartments in Baltimore, and I'm over here like on the west side of MLK in a row house. Like, okay, you know, people can make different financial decisions. But I think, again, educating people on the front end is extremely important. And then, I mean, then you get into like just the attraction of people to PT school. If we are losing people from the profession, we are only graduating so many, then the pipeline becomes so much more important to get kids at high school, get kids in middle school, expose them to healthcare, show them what PT is. I'm not sure, I think you probably have a little bit more rules and regulations with internships than we do in the you know, more private sector. But we have high school interns that are able to spend time with us during a period of their day, 2 periods of their day. Sometimes they're spending time with us in the summer. Sometimes they don't even go on to be PTs, but they just go on to healthcare overall. So I think if we look at this on a more widespread level, and more health care organizations outside of just rehab facilities are allowing young people to see what that environment is like, exposing them to some of the challenges, informing them as much as possible, not just about the job, about the financial ramifications, about some of the different career pathway tracks. Then you start those ideas like at much, much younger ages, and then it's very, very interesting to see where people kind of spiderweb.
Yeah, I think what was interesting that we heard about is that, you know, in high school especially, people think of being a doctor or a nurse, but PT doesn't really come across naturally. And so many students that we talked to said, oh, I learned about PT because I went in to be a bio major or a chem major, and they happened to have allied health. Was that you?
I was a bio major.
And I think this idea of consumer awareness in general for physical therapy is important, especially for direct access, and consumer awareness for middle school and high school that this thing called physical therapy is a real profession and it's super dynamic, and as we talked about earlier, has many tentacles for like different directions and different growth, not just treating. I don't mean it like that way negative, but if it is a great foundation, even to treat a little, I mean, to be a hospital administrator and to have been on the front line and in an outpatient clinic, I really understand workflow. I understand operations from a different point of view and the patient experience. But I think it's very interesting that many middle school and high school students don't even recognize it as a potential profession for them. And I think we just need to do more. And I think what you're doing is great. We do some volunteer work, but usually it's more geared to people who think they want to apply to PT, so they have to do the 40 or 100 hours that are required.
Right.
So now those students already know about it. I was kind of reflecting like what you do on the students who maybe never even heard about it, which seems to be the majority.
Yes, and that's like one of the things that we try to do. Like we reach out to guidance counselors twice a year. Before first semester, before second semester.
Okay.
What career days do you have? What guest speaking opportunities do you have? Hey, we will host your high school students. We provide them with materials while they're with us. They have little like worksheets to fill out. So being intentional, I think, about creating an internship program is probably a whole separate conversation itself.
Yeah.
You talk about having a pipeline for anybody's listening out there who's in business and you're maybe struggling, like creating this longer pipeline, this relationship development. I would almost equate it to the parallel between your marketing funnel for patients and your marketing funnel for people. If we don't have awareness engagement earlier, it becomes very, very hard to then have people when you need them. So we need to create awareness and engagement at these younger and younger levels, attract them to the healthcare ecosystem, really, really make sure that they're, again, aware, engage them with what's going on, and are in a situation where they go, hey, I want to be a PT, or at least they're a PA and they know about PT now because they spend time in PT. Maybe they become a physician, but they know about the value of PT. So if anything, we've educated them at a whole nother level just by allowing them in the ecosystem, even if they don't choose the profession. So by bringing awareness to your Gen Pop, and especially at that high school age, the teachers become more aware, the guidance counselors. Imagine you're in a career day, all of the different people that meet you, and they get to hear the physical therapist presentation. So it really takes an ecosystem approach, but there are also young people that they add a vibe to the clinic, right? Young people, naturally, they come in, they got a ton of questions, they've got great energy, they do funny things sometimes.
Correct.
Maybe they dress a little bit funny. I don't know what's up with this flannel and pants and croc phase that I feel like all the high school kids are going in. But, regardless, we have conversations about dress and attire and stuff sometimes, but it allows you to really expose people, which I think at the end of the day is what we're trying to do to the profession. Yeah.
Josh, thank you so much for joining me today. As always, I love speaking with you. I love your energy. I love your vibe.
I'm just trying to match you.
And listen, thanks so much. Have a great day. I appreciate it.
Thanks for having me.